you very much, Chairman. I'm overwhelmed by what I've heard and learned by the two previous speakers. I'm going to take a little bit of a different strategy. I'm just going to give you a practical understanding on how an average individual who's a busy clinician can incorporate research into your daily lives. We've just listened to two great researchers and leaders talk about the philosophy of life. How can you and I sit down, go to work every day, sometimes for 8, 10, 14, 16 hours a day, write papers, and make it happen? So everyone has to have an intrinsic motivation. Do you do it to discover the best care? Do you do it to come up with algorithms and systems of treatment that we all can adopt? Do you do it for quality improvement? Or do you do it for cost savings? Understanding what the best methods to manage a tibial fracture, a spine fracture, what is the safest, what has the least complication? That's the most important thing. And when we finish our training, everyone is interested in research. In fact, when people interview with me in my fellowship, 100% says, Dr. Vaccaro, I want to do your fellowship, I want to be a professor. But in reality, when they leave, hardly anyone does research. 50% go on to some sort of academic prospect, and I say that's a shame. 100% of us, when we leave practice, should have some interest in looking at outcomes and research. So when you first finish your practice, you say, listen, I got to build a practice. I've got to meet the consultants. I have to go out. I have to advertise. I have to do this. And then once you get busy, I can't do it anymore. I'm too busy. That is such a shame because, as the two previous speakers have said, you don't reinvent yourself. You don't rediscover your interests. Go out there, find out what is interesting to you, and do research. So why do I do it? I do research because I'm fascinated when a pharmaceutical company comes up and says, we have a new biologic that may improve spinal cord regeneration, or we have a new injectable that may decrease symptomatic back pain. We have new technologies, new robotic methods of treatment. I think that is fascinating. And that sort of reinvents me as a spinal care physician. Every time I could look at my life and I say, well, that's really interesting. I want to get involved. And you can be at the forefront of that. As Roger said before, when we do these studies and people come to our institutions, we raise money. We raise those money so everyone can be treated for free. When you do a study in North America in an investigational device exemption, it is for free, so you can incorporate more people in getting treatment modalities that may make it important. If you're a hospital like Raja comes from, you can differentiate yourself as a university or an institution that gives care that's the newest, latest, and hopefully most effective. And then, as Raja also said, you stand out among your peer group because you're taking that time in your life. You're just not going to work, operating, making money. You're spending time educating, teaching, and doing research. So I think it's important. The most important reason why I do research is because once in a while, as the first speaker said, 1 out of every 10 times, we will hit on something that makes a difference in someone's life. So I think it has an impact on both how you feel about yourself and how you can improve the quality of people around. So what are the problems with doing research? If you're in a private practice, you're just getting by. A, you don't have the time. B, where are you going to get the money from? Who helps you get started? And then unfortunately, a lot of the graduates, as I said before, greater than 50% says, well, someone else will do that. I'm here to take care of those with orthopedic injuries. Well, that's not true. Today in North America, we're obligated by the Affordable Care Act to use electronic medical records. As we move into the world of artificial intelligence, we'll be able to take unstructured data from the plethora of information and take things that are important. So if you have a question, if you have a hypothesis, artificial intelligence can grab that information out of an electronic database and make it more organized. That's the first thing. We get all of our surgeons in our group to be motivated by research. In fact, I'll show you a slide. To be part of our institution, and we have 210 orthopedic surgeons, you have to do research. If you say, I am not going to go do research, I'm just going to be here to operate, you're relieved of your position. So everyone has to get involved. And we make it so it's not expensive. We all contribute a portion of our salary to do research. We don't say we don't have funding, we can't do it. We do something called retained earnings. At the end of every quarter, if they pay us $1, we take 5% out for research. So this is what we give our shareholders, the 210 surgeons at the Rothman Institute, in order to become a partner. And as Raja said, after 3 years, everyone's equal. So I've been in practice for 30 years. Someone 3 years out is equal to me as a partner, but they have to do the following. They have to be board certified. They have to have acceptable outcomes, and we measure outcomes in terms of readmissions, infection rate. They have to show citizenship. They have to participate in committees. They have to demonstrate scholarly activities. And how do we do that? We have a not so complicated academic point system. So if you publish in a peer-reviewed journal, you get 25 points. If you do call, you get a certain amount of points, and if you contribute to academic meetings. So that's the point system. If you do not get those points, you do not become a partner. And that's how 100% of everyone in our group contributes to research. So we make it part of the system we work in. We don't say, you could do it if you want to. You only should join us if you want to do it. So how do we help the partners at the Rothman Institute? We have to develop a research infrastructure. You have to ask relevant questions, as the first speaker said. You have to ask questions that are important to the global universe of patients. It cannot be expensive, it has to be simple, and it has to be consistent with what you do in practice. I roll my eyes every time the government comes up with another rule for physicians. I'm like, well, that's going to increase physician burnout because it's not something I do on a daily basis. Please make everything that you require me to do something that I do on a normal basis, something that can be pulled out of the systems that I work with, so you don't ask an extra burden. We do the same thing for research. So every Monday morning at 6 o'clock in the morning, we have our research meeting. And we have 25 students there. And each one has to get up and talk about the studies. We begin with the medical students, the residents, the fellows, all the way up. And it's the medical students that do the hard weight. They're the ones that collect the records. They're the ones that do all the miscellaneous manual work. The residents oversee the projects. The fellows help rate the projects. And the professors help create the ideas. So that's how it works. So we commit to it. We give the time. And we also pay attention to two special things, compliance and funding. We have to keep that in mind. Compliance is very important. We cannot do a research study. We cannot look at a patient medical records. We can't do anything without getting approval. And that's part of the ethical review board. The only time in America that you may not need an IRB approval is with a single case report. And even then, we always ask our IRB if it's necessary. So those are the things you have to look at. So before you ask a question and you have a hypothesis, you have to sit back and get approval because you have to deal with conflicts. You have to deal with the ethics of doing it. You just can't say, I have an idea, I want to experiment. That doesn't happen in the world. Doesn't matter where you come from. Then you have to invest in a certain infrastructure. You need to have a clinical coordinator. You need to have someone that sits down with you every week that helps you get organized. If you don't have a statistician, you're lost. A student can't do it, a resident can't do it. You have to have a dedicated statistician. What's the end number? What's the power? What do I want to show? How many patients do I need? How much is it going to cost? And you have to have the administrative support to do it. So my coordinator is important because the coordinator keeps track of all the meetings, keeps track of all the manuscripts, the deadlines for abstracts. Most importantly, the IRB, the Institutional Review Board, they have a series of questions that have to be answered, and you better answer them. That's one group of people you do not want to get on the wrong side of, the Ethical Review Board, because they'll shut you down when you're doing research. So you may come from a private practice that doesn't have one. Well, there's organizations that will do it for you. The coordinator is important. So if I'm doing a study saying I have a new gadget that I want to see if it's effective in spinal fusion, they'll help schedule patients. They'll make sure all the data points are collected. They'll make sure the documentation is perfect because we do self-audits. Every quarter we self-audit these studies. So it's important that you get to know the study monitor. They tell you what's going on, and the study monitor comes to our weekly meetings on Monday morning. Now, if you're young, you have to do what you're interested in. If you do tibial fractures, do a study on tibial fractures. If you're a joint surgeon, do something related to joints. I'm a spine surgeon. Anything interesting that's in spinal cord regeneration, stem cells, so forth, I'm totally interested in. And then I walk around and I talk to different facilities that are doing the studies. So we all have societies that we can go to. Like this meeting now, as I sat here today to listen to the different studies, I came up with 4 or 5 very interesting studies that I may want to do with spine surgery. Everyone's so interested in the stem cells. I've been asked 6 or 7 times today about stem cells. We were participating in a spinal cord regeneration stem cell study that we shut down because we had lack of funding. But I'm looking for other studies to get involved. So the different societies that we belong to will help us get involved in understanding what's important. Now, you may or may not have electronic medical records. It's really important to have a registry. You could do this by paper. You can have an Excel spreadsheet. But if you have an electronic medical records and something more than that, I'll talk later on artificial intelligence, but as we put so many things in electronic medical records, we copy, paste, we forward, but we need a way of extracting information from electronic medical records that are useful to not only treat patients, but if we have to do research in the future. We at the Rothman Institute place every patient that comes in non-operative and operatively into a registry. So that costs money. That's the money that we take from retained earnings. So we can follow, is non-operative care effective? What I found in spine surgery, I spend more money on the non-operative care of back pain than I do on the surgical management of back pain. Patients get injections, they get pharmaceuticals, they get manipulation. Patients can be churned through the mill for years, and surgery may be cheaper. This is the information I need. So we use registries that follow our non-operative patients and our operative patients. And you could have simple outcome measures like a VAS, an ODI, an NDI, or it can get much more complicated. They can be patient-specific, disease-specific. It depends on what you want to follow, but it's not that complicated. And you make it part of the patient intake. When the patients come in, they fill out a form. If you have the ability to send the form electronically to the patient before they get to the office, that's even better. But we try to make sure before the patient leaves the office, and the time they wait in the waiting room, they can fill out all the papers. So that's one of the most important things. Another thing you never want to do, and it actually was a phone call I received this morning, is get involved in a study because you're a nice guy but you're not interested. If you're not interested in research, if you're not interested in a study, do not do the study. This morning, I'm 10.5 hours ahead of New York, and I received a phone call from a study supporter that said, how come your university is not enrolling patients in this study? And I had to be honest. I said, because the study is horrible. I'm not interested. I shouldn't have said yes to you. It was my mistake, and I apologize. So don't make that mistake. Get involved in things that you're interested in. Because if you're not interested in it, you're not going to do a good job. Don't get involved in studies that you don't think will affect the care of a population of patients. This will be a multi-year commitment. Most of the IDE studies that I've been enrolled in, 5 to 7 years. And now our governments are asking for extended follow-up. We have arthroplasty devices in spinal surgery now. Well, it's great. After 2 years, they got FDA approval. But do they still function as an arthroplasty device at year 3, year 5? They're going to want to know. So you have to really be interested. So when you do research, you can come to a meeting like this. This is an honor for me to be here in India, to be with you, to speak among yourself. And it happens because we do research. So as a result of that, we regularly attend conferences. And as the first speaker said, the first thing I said when I landed here was, what can I see in the community to get to know the people? It's just not the meeting that I go to. It's getting outside the meeting, meeting the people, traveling, and see the sites. So tonight, I hope someone tells me where to go at 2:30 when I'm free tonight, so I can go out and see the area around here. I've also made great friends. You know, most of the people in this room in spine surgery I know. I met you through meetings, so it's one of the motivating factors in my life to do research. And it has really contributed to the growth of myself and those who also do it. So at the end of the day, it is not as complicated as you think it is to do research. Make it part of your practice. Make it, as Raja said, Raja gave all the reasons on who he selects to join Ganja Hospital. You have to be internally bred. You have to come up. He does that because he wants you to be committed to what he's committed to, and he's committed to research, because at the end of the day, his research allows us to care better for people and improve people's quality.